Hey guys, Luis Moreno here with Think Medicare, Think ACA. Today I'm talking with Dalton from RetireFlo. It's a new program, at least new to me. I just found out about it, but it is a program that's going to help us with Medicare and ACA. I don't know much about it right now, so I'm going to be watching what he presents to you guys at the same time that you all are watching this. So Dalton, man, wow us with the benefits of RetireFlo for ACA and Medicare.
Well, thanks, Luis. And first of all, incredibly awesome to be on with you. I follow your YouTube channel. I'm tapped in online. I'm always seeing stuff about that you're posting and just trying to keep people informed about what's coming with the Inflation Reduction Act, how to get prepared, how to build workflows. And based on what I've heard from other agents, it's and I have heard this, that you are the workflow master when it comes to Go High Level and a bunch of other cool platforms. But I really appreciate the opportunity to be on. My name's Dalton from Columbus, Ohio. I went to The Ohio State University. Don't hold it against me. Okay, I know you're a Texan down there, but I come from an agency myself. Started working for my dad's Medicare agency about 5 years ago. Okay. We're a small LOA shop in Columbus. We only have about 7 or 8 writing agents on our team, but my dad's been at it for a long time. So we've grown to serve approximately 23,000 seniors with the Medicare Advantage or supplement policy. And we're really proud to do that. It's a lot of people, but, and Luis, I'm sure you can relate to this, we created a little problem for ourselves. And that problem was all of our clients started to call us every AEP and ask us the exact same question, which is, Joe Namath says there's something better out there. What you got? Or am I still good on the plan that I'm on? And the call volume was crushing. We could barely survive. We were either going to have to hire a call center to manage the volume, additional payroll, or we were going to develop something. And we developed this product. And when we did, we remediated our retention issue, but then we also realized that we created a very cool new business tool as well. So I'm going to spare you y'all the basics of me talking about what's required to do a good job providing people with plan options. You guys don't need to hear me complain about Joe Namath and Medicare Martha and JJ Walker. Other than I will tell you, I was on with an agent a couple of weeks ago who told me that my glasses reminded her of Medicare Martha, which hurt my feelings because I need these, and that's my arch nemesis. But these TV commercials mislead people, and they confuse our senior clients about what Medicare is about. So we wanted to develop something that better connects agents with their clients, gets seniors the answers quicker, so that way nobody calls these people anymore. We want people working with their local agent. So I'm going to talk about the Medicare piece of this first, and then I'm going to talk about our brand new ACA product, which we're excited about too.
Hey, Dalton, okay, I had to go look her up. She's on the screen. I didn't notice that, but I looked her up with my other one. And man,
it's not a compliment.
Man, the glasses, all right? The glasses.
They're big, but my vision is terrible. I need them. So yeah, it's embarrassing. Got to be able to see. So what did we do? What is RetireFlo? Well, it's a set of online surveys that you can send to your clients and prospects in advance of a meeting. It's going to ask them somewhere between 9 and 13 questions, depending on which survey you choose from us. And on those survey questions, the font is humongous. It asks one question at a time. It's incredibly easy for seniors to complete. And when they do, you capture 3 things. 1, a list of that client's prescriptions, doctors, hospitals, and pharmacies. On those prescriptions, they're spelled correctly every single time. Dosage, quantity, frequency, package, brand of the generic. Everything you need to go out and run a quote for your clients, whether you do that in Connecture, Sunfire, the carrier sites, whatever. It's designed to work for everyone. And our survey has been approved through the health plan management system. So we're CMS compliant. And the benefit of that is it also means that you've now achieved permission to contact with that client. So it works great for your prospects as well. And then lastly, the final question in our survey is that pesky scope of appointment form. And look, there's a lot of services out there that provide scopes, and that's okay. But the reason we do it is because let's say you're meeting with a client next Thursday. You got an appointment in the books. You say, or we'll call her Susie Senior. Hey, Susie, I'm looking forward to our appointment. I need you to complete this survey by next Tuesday.
This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information.
That's going to get you a compliant scope, which is great. But more importantly, it's going to get you those drugs, doctors, hospitals, pharmacies at least 2 days in advance. You can do all that plan research, show up locked and loaded, quotes in hand. And in advance of this annual enrollment period, Luis, and you can attest to this, it's going to be a mess. I call it the Part D tsunami, with all of these changes coming from the Inflation Reduction Act, all of these insurance companies probably not treating brokers the way that they should, and how they were paying out commissions and things like that. It's going to be such a mess. And you can use RetireFlo to simply mass blast out a link, collect all this good stuff, and show up to every single meeting after October 15th, prepared, locked and loaded, and ready to go. And I would tell you that we take great efforts to make this thing as senior friendly as possible. This includes, we put your logo on it. It's white labeled. It looks and feels like you. In fact, your headshot is going to chase your senior clients throughout, offering helpful guidance, saying, hey, I'm Agent Luis. I'm asking you these questions to provide you with plan options. And before I talk about the ACA portion of this, I do want to mention our two best features. Our best feature: no username or password or code required for your senior clients. You send them your RetireFlo link, they answer the questions, they're done. That's it. We know our audience here. Seniors don't do well with that stuff. I'm 28. I don't do well with that stuff. So super easy for agents, super easy for seniors. The other really cool part of our system is when your senior clients complete that survey, you're going to get a corresponding report summarizing all of that client data, all these things you see here. And that report is also CMS compliant as well. And that comes in handy, and I'm sure you can relate to this, if you ever get a grievance filed against you. Let's say you met with a senior client who you enrolled in the plan, everything was fine, and then 6 months later, a grievance is filed against Agent Luis here. It says, you didn't do a good enough job explaining whether her Eliquis was covered. And you're like, she never told me she took Eliquis, happens. Our senior clients can be forgetful sometimes. Now you've got a CMS compliant, HPMS approved document that you can send in and make that grievance unfounded. So for lack of a better term, a little bit of a built-in CYA function.
Big time. Dalton, so let me, I'm going to chime in on this because my
do.
latest complaint is exactly what you just did. Now, I've been solving this another method. I like your method better. So I went into a home and I was doing an MA presentation or Medicare presentation. We decided to go the MA route. I told her, hey, Mrs. Jones, go get me all your meds so I can check them. Because I hate when they just give me the names, because there's the names, they're very complicated, and sometimes it's more than one name.
And you're not a pharmacist. I'm not a pharmacist,
No. I mean, there's the one that gets me all the time is the one that's sucking it.
Yes.
I don't even know if I'm saying it right. And then there's another one, the same first name. Anyway, it's confusing. So she comes back a few minutes and she hands me the meds. And what I used to do, or what I do, is I take pictures. I'm snapping pictures. That way I have proof. So I did my job. I confirmed the meds. We were rocking and rolling. A month later, I get a complaint. Hey, this medication is not covered. I'm like, did I screw up? I'm like, I'm going through my pictures. And I'm like, it's not in the pictures. It's not here. You know what it was? It was a medication that was in the fridge. She forgot to bring it. Of course, it's not my fault. So again, what I do on the complaint, I send pictures. Hey, look, this is all she showed me. I don't see the medication it's in the fridge. And then I never heard back. I mean, the complaint.
And right before we get to the prescription question, and here we have a big, gigantic font screen that says, go get your prescriptions. This part's important because it is. It's an incredibly important part of the Medicare formula to do a good job providing someone with plan options. So we got to have accurate snapshots. And that's what we're going to help you do. And it's just a simple way. It's a low pressure, easy, actually very affordable way. You're going to hear about how much it costs at the end. But we launched this product just over a year ago, and RetireFlo is proud to serve thousands of Medicare agents across the country. In fact, we process a submission every 5 seconds on behalf of a senior client, and on behalf of an agent across the country. And we find that we're anticipating doing a submission a second this AEP, which is going to be awesome. But we roll out this functionality, and agents that I've been in front of, and I've been in front of hundreds, maybe even thousands in the past year, all ask me, well, all right, Dalton, I do ACA too. I like the way this works. I like the way the workflow works. Would you offer an ACA survey? Well, we do.
Beautiful. Okay, hold on, Dalton. I'm going to call a timeout right here. Hold on.
Okay.
Go right back to the previous screen.
Okay.
Okay, so we got about 800 agents with us, and I help them when they get these complaints.
Yes.
I would put, I'd say 50-50. 50% of the complaints are medications. So you're
Yep.
going to solve that problem here. The other 50, what do you think they are?
Scope.
The what? No,
No, not the scope.
not the scope. No, doctors.
Doc, well, we're going to get that too. You know?
Yes, and I see it here. Docs. Now, hospitals, not very much. Pharmacies, not very much. But doctors, I can't go see my doctor with this new plan. So I like the fact that here on your Medicare portion of this thing, you're covering the drugs, the docs, but hey, the hospitals and pharmacies, why not? Because in our plans, pharmacies are either going to fall under standard or preferred, and they're going to get better pricing on the preferred. So you might as well ask for this. Now, I am going to tell you this one, and this is maybe something to think about.
Okay.
Is possibly adding DME providers.
Yeah.
Think about that, because if I get my oxygen tank from this DME provider, and now I move to another plan and that DME is not in there, now I got to go, I'm going to have a break in. There's going to be a little bit of a problem.
Sure.
So maybe down the line, Dalton, you can think about, hey, do you have any equipment that you rent or an oxygen tank that you get? So they may have a wheelchair, they may have a walker that they rent, or a scooter, or possibly even one of the beds that helps them get up, or a chair that helps them get up. Something to possibly think about in the future is maybe adding that DME.
Well, when our survey goes from 9 questions to 10 questions, well, it's because Luis added a question there. It's a great idea. And we've ventured into that space a little bit. One of the things that we're really proud of is our partnership with Advanced Diabetes Supply.
Yes.
We notify you every single time a beneficiary takes a diabetes prescription, to help you connect with the folks at ADS, and you as the agent only get notified. But just, you want to make sure when you walk into your meetings that you're prepared, that the full scope of what's going on in their lives. And I love the DME idea. All right.
Yeah.
Well, stay tuned.
So permission to contact, is that prior to getting the list of drugs and docs? Is that what?
It's all in one. Yeah, it's all in one. So whenever somebody completes the survey, you capture all these 3 things at once, which is very, very cool. So
beautiful.
Anytime that somebody's comes through that door, you're locked and loaded, ready to talk to them.
Awesome. Okay, man. Awesome. Let's rock on the ACA.
Okay. So everybody's asking, do it for ACA. Well, here's what it looks like. It's 11 questions long. It's the exact same functionality. You get a link, mass blast it to your people, retireflo.com/Luis ACA, or whatever you want it to be. You get to choose your own URL. It's going to be white labeled with your logo and headshot, and it captures 5 major key data points. 1, dependent information. So who do you claim as dependents in your household, and do they need coverage or do they not need coverage? On those dependents who need coverage, drugs, doctors, hospitals, and pharmacies. The same functionality you saw in the Medicare survey, that's what's showing up over here on those respective dependents who need coverage. We capture for everyone smoking status, income level, year of enrollment. We even offer like a little helpful tips throughout to say, hey, here's how you calculate that. And then it ends with the consent form. So it really speaks to what RetireFlo is designed to do. RetireFlo is not necessarily designed for you to send a survey and then enroll them in a plan. That's not what it's for. In fact, it's probably not really compliant. What RetireFlo is designed to do is to capture all that hard to get information So that way you can do all that research at home on your own time and then show up and have a thoughtful, prepared consultative meeting with your ACA client or with your Medicare client.
Dalton, dude, this is incredible, man.
It's a game
I'm
changer.
even thinking right now, just with my mind that's running 100 miles an hour, and I got the little
The workflows are working right now.
I'm thinking, hey, for those agents, those of us, like I'm in that category that advertise on social media, how cool is this? You do your ad, client sees your ad, they click on the call to action, they go in there, they enter their information. Then the way I have my workflows is my agent CRM that I utilize captures that data because it's linked up. And then how cool would it be to send this link to the client before you call them and you say, hey, Mr. Client, whether it's a Medicare client or an ACA client, you have to specify, and you send them the appropriate link and they fill this out and then you call them. But you have all this data. So instead of capturing it over the phone, they can now capture it using this app.
Well, it's a little from a consultative perspective, from a sales perspective, it gives you sort of a hook, just a small one to say, hey, I've done the research on you. I actually have run a quote and I've got some plans that I think might be a good fit for you. You know, let's work together. Because these people want to know, oh, he's put the time in, he's done the research. He knows, he took these things that are important to me into account in this process. It's one thing to be a reliable person in your community where people trust and call you. It's another thing to put the things that are important to our beneficiaries into account as you're doing this plan research. And so absolutely fantastic way to do it. Even you're talking about the marketing of this. We're designed for digital marketing. You can put us in a constant contact. You can text the link. It works great on a phone or a tablet or an iPad or a computer. Doesn't matter what device. It's going to look incredibly professional. We even give you, baked into our system at no additional cost, a QR code where you can pick the colors and print it out, send it out on a marketing piece, include it on your business card, whatever, it drives them straight to the survey. So very, very cool functionality there. And I will tell you, we're working on it for ACA, but we don't have it quite yet. But on all of our Medicare surveys, we have a built-in automatic Spanish translator. So for those of you who have Spanish-speaking beneficiaries, click on a little button that says Espanol in the top right corner, whole thing automatically translates into Spanish.
Beautiful.
You know, there's a lot of value here. Imagine streamlining your AEP in an afternoon, collecting hundreds and hundreds of submissions. I know, Luis, you serve thousands of clients. You can just blast this out in an email and start collecting submissions. And just to give you a little color on how many you can expect to get back, we had an agent in Ohio who sent out last year on September 15th, so just a couple days ago, a year ago, a link to all 2,000 of his clients. Said, hey, AEP's coming up. If you'd like me to review your plan this fall, click here, complete the survey. Again, Friday, September 15th at 5 p.m., he sends this email. Over the weekend, the guy does nothing. He watches Ohio State beat Notre Dame, goes for a walk with his wife, shows up to his office on Monday morning, 200 submissions on his page. From one email, 2 days later. He sent that same email 4 more times. He got 936 submissions before October 15th. 936 people he didn't have to listen to try to spell levothyroxine over the phone or worry about getting a signed scope. Or in the ACA universe, worry about getting consent forms and identifying what is the household income. Wow. It's a no-brainer way to get prepared. And folks, it's incredibly affordable as well. For everybody else.
I'm going to ask you 2 questions.
I'm burying the lead here, you know.
2 questions. Again, more things going through my head. So, dependent information. What are you capturing? Date of birth, social, gender? Everything.
We don't capture social, but it's date of birth, name, who you are to the person that's completing the survey. So I've got Bob and Betty Buckeye here. So if Bob filled this out, we're going to capture that Betty's Bob's spouse. Income level, smoking status, and I believe that's it on the.
Did you say date of birth?
I did say date of birth.
Perfect. Okay, cool. Now, I'm going to go to this consent form for ACA. So guys, this is a little PSA for you guys.
Yes.
Okay. Deal with a lot of agents daily. And right now, CMS is trigger happy. Okay. They are handing out suspensions like it's candy on Halloween. Okay. It's happening. I'm seeing agents calling me, I got suspended. Here's what's going on, guys. If you cannot produce the consent form, you're screwed. You are, I mean, if there is a complaint made to a carrier or to CMS, you're screwed. Make sure. Oh, and I also found this out, Dalton. This is like, right hot off the press. When there's a three-way call being made to CMS to change the agent of record, they are asking this question. Do you want to report the other agent for fraud? Wow. Dude. So what's happening with that is if you get reported, I mean, let's just say it wasn't fraud, but they say, yes, sure, because they forgot who you were and they report you. If you don't produce consent, and secondly, there's another form that's missing, but that's
the attestation form. Yeah, that's that. Yeah.
The confirmation. Guys, you're gonna get suspended. Okay. And and CMS is not very quick at responding to you saying, hey, no, this wasn't fraud. Look, I've got a consent form. I got a confirmation form. I did enroll. I've got all the data here, recorded call, whatever it is that you use to communicate so that you can protect yourself. I mean, it's going to put you in a bad spot. So I love that you're getting that consent form. Is this going to be a signature consent or a check the box consent?
Signature consent, which is very, very cool. And just to give you a little, I'll just walk you through a little bit what it looks like on the back end.
Okay.
So when you sign up for RetireFlo, you're going to get access to this dashboard where all of your submissions are stored, and your ACA ones and your Medicare ones are going to be mixed in here. You can sort them based on which ones, you want to do which with, but we're going to capture that data. And then you can sign your portion of the scope to accurately reflect the meeting that took place. Same with the consent form. So here, for example, Susie Senior came in this morning. This was a demo that I did. And this is what you get on Susie. This is a Medicare survey. All of that pertinent information that you need to know about her to begin running quotes. Name, address, zip, county, email, phone number, prescriptions, dosage, quantity, frequency, package, hospitals, doctors. As you can see, everything's spelled right every single time. Then that scope, signed, dated, initialed, compliant with Susie Senior's IP address. But note, at first, we leave this agent section blank because we want agents to be able to sign it and make it accurate based on the meeting that took place. So you press that sign button, you can fill out your portion of the scope, forever modify that document. But it works just the same as the ACA consent form. So we'll get the hard part, your beneficiary signature, and then we give you the opportunity to sign it to make it accurately reflect the meeting that took place, and back you up. Because it's not a perfect thing every single time. Maybe Agent Luis was sick that day and somebody else from his team met with that beneficiary. You don't want to have it pre-baked with Luis's signature on it. So that's what we do here in your submission center. You can even leave yourself little notes. Susie Senior came in here. Susie's husband is 63, needs ACA survey. Boom. So you can leave yourself little notes. But let's say you use RetireFlo and you get 500 Medicare submissions or 500 ACA submissions. By the way, very possible on our system because it's super easy to use and blast your clientele. You can always export all that data into a giant CSV or Excel file, upload it to your CRM, run a report of all of your clients that take lisinopril, track and manage your annual enrollment period, built in here at no additional cost, which is very cool. Now, I will tell you that works great for every CRM, but we have some more ingrained integrations with CRMs like Go High Level platforms. Agent CRM, I know you're a big user of Agent CRM. We are available in the app marketplace for Agent CRM. It's only currently our Medicare survey that's in there. So it's for your Medicare people, but we're working on adding ACA in there as well. But we got a bunch of cool integrations coming for all those agents who are tuned into it. I have my finger on the pulse of what CRMs agents are using. Go High Level is the easiest one because they allow people to build apps inside that app store, which is a great feature. But yeah, so if you've got a CRM, we want to work with it. But Luis, can I drop the bomb on them on how much it costs?
Well, now, were you going to show a demo of how it works?
Sure. Yeah.
I saw a demo. I was like, okay. And then I'm going to ask you this question.
Okay.
I have an agency. I've got 9 agents here in my office. Does that mean that one account can work for all 9 of them, or do they need their own separate ones?
But it works. It can work however you wish. So if you've got 9 agents and you want to be able to track, okay, this one came in on Bob's page, but this one came in on Luis's page, I would recommend having multiple surveys. But you can also have one agency survey and have it work for your entire agency. You can invite administrators to your account here in the account settings under user management. You can invite as many people here as you'd like. You can also subdivide it and make it so Bob can only see Bob's submissions and Luis can only see Luis's submissions.
Got it.
And then you could have administrators who can see everyone's submissions.
Yeah, I think that'd be cool because I have one lady who helps me with Medicare, and she's an LOA agent. She's my agent, my employee, so she can get set up with that. And then I have 2 guys that help me with ACA. They could each have their own, and under one account.
Yeah, totally.
Ooh, I'm liking it. All right, let's do the demo and then we can drop the bomb.
All right, because there's good news coming, folks. So I'm going to head over to my survey and kind of talk about the functionality of it. This is what your survey will look like on RetireFlo. White labeled with your logo in the top left, your headshot, your hometown, your state licenses, links to your social media if you want to. That part's optional. You heard me talk about our automatic Spanish translator. It's built in right here in the top right. So when you click on it, hola, soy Dalton Miller. I don't speak any Spanish, but we worked with a professional translation company, so it is in a good Spanish dialect. It's not going to sound.
If you already know that you got a Spanish speaker, can you send it out in Spanish, or do they have to click the button?
Oh, good question. Absolutely. So if you type, so you get a link, right? retireflo.com/Luis. You're automatically, if you send out retireflo.com/ES/Luis, shows up in Spanish upon arrival. Box already checked.
Okay.
So very, very cool. Yeah. So that way they don't even have to check the box. And I'm going to switch it back to English for my sake here, but what's your name? Susie Senior. And our survey is really intuitive in that it's going to take Susie's name, kind of narrate the survey on your behalf. Hey, Susie, let's get started. We're going to ask her for her email, susiesenior@aol.com. Now, folks, all of our questions are optional. So if Susie doesn't have an email, that's okay. She can skip it. All right. Now, Luis, I'm going to put you on the spot. Give me a real address where Susie might live.
Okay, let's go with, we'll use my office address. Let's do 8865 Grissom, Grissom. There we go.
SSON. Oh, OM. There we go.
Yes,
So when
right
Susie selects her address, it's going to auto-populate with her zip and her county. So she doesn't have to type it, but you're still going to capture all that information. And it goes down to that specific address where that county, that's how we pull the county. So I know there's sometimes there's zip codes that share counties. We're going to get it right every single time.
Got it.
We asked for that phone number, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we asked for her preferred pharmacy. She can add up to 3, but it's going to take that zip.
Let's type in, since we're here in my area, let's type in HEB.
HEB. We don't have those in Ohio. Here it is.
No, this is the Texas thing.
Even your local pharmacies are going to populate. So you're in a rural area, you've got local pharmacies. This is going to do a 50-mile radius search, but even your local pharmacies are going to populate. So I'm going to guess there's a CVS near you probably that's going to populate there as well. And she can add up to 3. Okay. Then we're going to remind her, go get your prescription bottles. This part's important. I've met with too many senior clients who go, I left my list of drugs at home. Do I need that? You're like, yeah, that's why I told you to bring it. Or worse, they come walking into your office with a giant bag of pills. That doesn't seem safe. I mean, you're taking pictures of them, so because you have to, right? Well, not anymore. And we also remind Susie that we're not particularly interested in her over-the-counters vitamins or supplements. Thanks, but no thanks. So let's say Susie takes Lipitor.
Okay.
Types in the first couple letters, pops up right at the top. Then we ask, do you really mean that you take the generic atorvastatin? Let's say she does. Then she's got a drop-down menu of available dosages. And when she selects that she takes that 40 milligram tablet, we're going to suggest to her a common user quantity and frequency. In this case, that's 30 tablets a month. But maybe she takes 90 every 3 months. She can edit those fields. But let's say Susie takes Ozempic, one of those ones that's in the fridge, right? Doesn't come in traditional means. It's not tablets or pills. When she selects her dosage, it's going to auto-populate with the package. So you're going to know, oh, this is an injectable, an inhaler, lotion, cream, something comes in non-traditional means.
Gotcha.
But lastly, let's say Susie takes Synthroid, another popular one among seniors. But this time, Susie forgets to tell you about her dosage. Tries to keep moving through the form. It's going to stop her. Say, hey, I need this if I'm going to do a nice job for you. So once she adds that dosage, she can now proceed through the survey. All of her information is correct. Then we're going to learn about her doctors and her hospitals. So Luis, where might Susie go to the hospital?
So let's type in Methodist.
Methodist. Oh, there's going to be a lot of Methodists on here. Every hospital in the United States that accepts Medicare is on this list. So
Okay, gotcha.
I don't know if that's the specific Methodist, but
you know what? And who knows? Let's try university. I think it's the university health system. You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare smart books. University.
A ton of universities.
You know, there's 3 major systems: the Methodist system, the Baptist system, and I think it's the let me check here.
Maybe I can try the university. But what we're doing here, the University Hospital. There we go.
Let's go with that. Let's try that.
So every hospital in the United States that accepts Medicare is on this list. So Susie Winters in Florida, she wants to add a hospital over there, she can add it. She's got a grandson in Arizona, she wants to add a hospital over there, she can add it. Because we recognize that not everybody lives in the same place all year round. And they want to make sure that hospitals are a network in different parts of the country. She can add as many hospitals here as she'd like. Then we're going to learn about her doctors. No drop-down menu here. This is really important. No drop-down menu. Just your headshot says, I need first and last name. That's important. So she sees Gregory House from the TV show and Meredith Ray from Grey's Anatomy as her cardiologist, her dentist, ophthalmologist, whatever. She can add those here. But what's cool about our system is that we're going to capture that name. Now, I understand that there's certain doctors who have certain offices. This is not what RetireFlo is designed for. We want to make sure that you get a good head start on doing your research and show them to that meeting. Hey, got a couple questions for you. Where does Dr. Gregory House practice? All right, perfect. We can rock and roll. So we're going to capture that name because there are new doctors every single day. In my opinion, I have some qualms with the existing doctor list that exists out in the market. And we don't want Susie to go looking for her doctor and not be able to find him. So we'd rather just capture that name so that way she can easily move throughout the survey and give you the information you need. Then your headshot says, here comes the scope. What the heck is it? Kind of a scary, cumbersome thing for seniors, right? They think they're signing their life away. Not our scope. Super clean, easy, highlighted and glowing. Where Susie needs to initial, she initials. I'm going to leave this ancillary one blank just for fun, just to show you what happens. She picks a signature that best represents her, and she tries to sign and complete. Uh-oh, I call this the guilt box. I pop this up just to remind Susie, hey, we noticed you didn't complete the scope, and that's okay, but we're only asking to provide you with plan options. You're not signing your life away. She can continue on, but we obviously encourage her to go back and complete it. And when she does, she gets this nice screen from you that says, your name from your agency will contact you soon. Now, instantly, I don't know if you heard it, my phone just buzzed. I got a notification in my email. It says, hey, you got a new submission on RetireFlo. Log on and check it out. So what do you know? I log into my RetireFlo account. It says, welcome your name. And I go to my submission center, and here she is, Susie. You can download it, view all that good, healthy data, all that information, zip, county, email address, phone number, prescriptions, pharmacies, hospitals, doctors. On the ACA side, it works just the same. And then that scope, signed, dated, initial compliant. You want to sign your section of it, you press sign right here.
Man, loving it, man. This is so cool.
Thanks. We're excited about it. We're proud to serve as many agents as we do. This is something that's a low pressure, easy way to get prepared for AEP. I mean, we're taping this on September 27th. And I would tell you that the Part D tsunami is cresting on the horizon. You know, I can see it. I can feel it. And I'm like, it's an easy way. If you're like, oh my goodness, how am I going to get prepared for AEP? You can turn this on literally in 5 minutes. That's
Right.
it. Go to retireflo.com, you press get started, and you give us your headshot and your logo. You're done. That's it.
Done. All right. So 2 questions. I'm going to get this. The headshot, guys, go get a photographer, or you know what? Use your iPhone. Pretty good camera.
Yes.
Logos. I know. How do I get a logo?
Oh,
all right.
Question.
I would recommend, I'm not a graphics guy, but go to Fiverr. Fiverr. Okay. You can go to Upwork. There's all these, you can hire a contractor, and there's some guys that can just probably knock one out for you. I think I paid $50 for my logo. And they gave me all these. Yeah, they gave me 3 different versions, and we went back and forth. I like this, change the colors, change the font, whatever. And then once I nailed it, then they provided me a package with all these different versions of the logo. Great. So go to Fiverr.com or Upwork. Is there another one that you know of, Dalton? You're a young techie guy. What do you think?
I don't know. I've seen agents do a nice job making their own too. You know,
What?
I've seen some not so good ones either. But the cool thing is RetireFlo, you don't even have to have a logo. We'll lend you ours. It'll just say RetireFlo if you don't have one. But you know, talk to somebody in your family who knows about technology stuff. I'm sure they would be more than happy to help you make one. But I think the efficacy of our system, how effective it is driven by the personality of it. So make sure that if you do have a headshot, upload it. I talk to agents sometimes, they're like, oh, I don't like that picture of myself. We all disagree with you. We all want to see you. We want your clients to see you. I think you're the reason why your business is so successful. So put your headshot on there, put your logo on there, and that's it. Give us some goods on you. You get to put your agency name, your state licenses. You even get to choose your website. All right, Luis, let's see if it's available. Oh, somebody beat you.
Oh, really?
I know. Sorry, but you get to Luis Moreno. That's
there
available.
we go. Well, perfect. We'll put my whole name on it. There we go.
And then lastly, you put your work email down here so that way you're notified when you receive a new submission. Press save. Instant. That's it. You're done.
Wow. Like it. Like it.
So, all right, let's drop the bomb. Let's do it.
Let's drop the bomb, man. Let's go. Okay. Here we go, guys.
How much does it cost, right?
I'm sure they're waiting. Come on, tell me.
Well, for everyone else, there's a but coming. There's a but coming. For everybody else who did not watch this training, it costs $50 a month to have a survey. You get unlimited submissions, unlimited sends. Doesn't matter how many Susie seniors go through it, $50 a month, which by the way, a deal. For $50 a month, totally streamline your annual enrollment period. But with promo code LM40, all caps, LM40, it is case sensitive, $29.99. You get 40% off, unlimited sends, unlimited submissions, no associated contract. No, you have to use this for a certain amount of time. On our traditional products, on our other products, there are some contracts associated with it, but you get unlimited sends, unlimited submissions. So I will tell you, each survey is $29.99 from us. So if you have a Medicare survey and you have an ACA survey, that would be $60 a month. But folks, to get to know all of your prospects and capture all that information you need on your clients in advance of AEP, it's a small investment in your business to have enormous return. Because I will tell you, there's going to be 2 agents this fall. There's going to be the agents who got ahead of it, of the Part D tsunami, and prepared, used RetireFlo to collect this data in advance. And then there's the agent who on October 28th is going to want to be doing something for Halloween, but instead they're going to be listening to Susie Senior spell levothyroxine over the phone. Life's too short. Use RetireFlo, get out ahead of it. So
Time is money, guys. When you have a big book of business, time is money. And so this puts the time on them. They can take their sweet time and go get the meds and type it in one finger at a time. And while you're doing other more productive stuff, and then when you get it, you're rocking. Now, one question here. All right, another one. The data that a client sends you, the meds and the docs, is there a way to take that data without manually having to do it and put it into Sunfire?
and to put it into Sunfire, not automatically, not automatically. With Connecture, for those of you, for the agents out there who use Connecture, we do offer that. But on Sunfire, no. But remember, you can always bulk export all that data into a giant CSV or Excel file, and run reports with it, copy and paste the drugs if you need to. But this thing is designed for that agent who does some enrollments in the carrier sites, wants to run reports on Medicare.gov, do things in Sunfire, do things in Connecture, because we found that while there's humongous enrollment programs that are awesome, our partners at Connecture are fantastic too, but enrollment's often segmented. It just depends on who your FMO is. And I do some of my enrollments here for this FMO and this one over here for this FMO. So there's a million different ways that you can utilize this system and capture that client data, and it works great in whatever system you utilize.
Okay. Man, beautiful. So here, I'm going to finish off with this, Dalton. I mean, this is a no-brainer. Okay. I mean, $30, right? 29 for the Medicare module.
Yeah.
If you're an ACA agent, the other 30 where you're collecting the consent, which is huge, but you're getting the doctors and meds. Guys, I preach this and you know, because we do it. You just can't pit a plan just because it costs zero. You can't do that. Okay. You might be able to get away with it with somebody who doesn't have any docs and meds, but the majority of the people have some docs that they want to keep seeing. They got some meds that they got to keep taking. So you got to find a plan. And the easiest way to do it is to have that data already while you're doing your research for them. That I think is super cool. And man, they can do it on their phone, which I would say the majority of people are on their phone. And that picture that you were showing looks really good on the phone.
Yeah, I tell you, so I told you we process a submission every 5 seconds. 65% of those submissions, of the hundreds of thousands, are taking place on a mobile device. So, and that's what we're designed for that. We want you to be able to text that link to your client, ACA, Medicare, whatever. You text it to them, they complete it, they're done. It takes them 8 minutes. Our studies show it takes these senior clients 8 minutes to complete. So that way you can be protected and you can show up to your meeting prepared.
Gotcha. So you're going to go to retireflo.com. Is that right?
That's right. Press this big started button right here.
And then there's going to be a promo section, LM40, LM Luis Moreno, my initials. I couldn't think of anything better. So that's what we just rolled with. I mean, I'm not the brightest guy out there. So LM40, and you're going to get 40% off. Knock it out. Is the ACA already available to purchase?
Oh, yeah. Yeah. So what'll happen is you go to retireflo.com, you press get started, you give us some information about yourself and your agency, you put in your promo code, LM40, all caps. And then at the end, we're going to ask which survey you'd like from us. We have Medicare Short, which is what we demoed here today. Medicare Long, which asks a couple of extra questions. They're all summarized underneath about current health insurance and do they want MA or SUP, or that they have access to retirement benefits like VA or TRICARE or a state retiree plan. Again, they're all summarized underneath. And then the ACA survey as well. So this is where you choose which survey you'd like.
Man, love it, love it. All right, guys. So I'll put the link down below. I will also post the discount code in case you guys forget, or you're watching this at some later time and the light bulb turns on later. But this is, I think this is revolutionary. Sometimes we find out about tech later and not a year ago when you rolled it out, but wow. I was trying.
We served, and the first AEP, we served 150 agents, and they really liked it. So we're glad they all stuck around, but now we're proud to serve thousands of folks. And the reason you're seeing this is because Luis is on the cutting edge of this stuff always trying to bring cool new tools to people. I watch your YouTube videos. If you don't watch them, this is the first one you've seen, start. Especially in the ACA universe. I mean, you're a rock star. So it's cool to be on here with you. I mean, basically an ACA Medicare celebrity at this point. So it's an honor to be up here with you. So thank you.
And you know what? If you ask me for my autograph, you will be the first one. All right, nobody
Somebody
says,
do it.
come on, I'll send you my autograph. Hey, here we go. No, I'm so glad to be here, guys. I mean, I enjoyed this. I'm glad we brought this to you because I think it's a good tool that you guys should be using. Again, we need tools that help us make sure we're doing our job right. And also, we get to buy back some of our time because we're not having to sit there. And you're right, with some of these seniors, I go nuts. I don't have the patience. I'm like, God, spell it right. Or
so they tell you how it's spelled, and then they also want to tell you why they take it. And you're like, whoa, I don't want to know. You know?
oh yeah, I've heard some crazy stories. So, all right. Well, Dalton, man, I appreciate your time. Thank you for being on here. And guys, again, if you forget, the information is down below. And I need a little love from you guys. All right. So make sure you like the video. Okay. Give me some comments. I reply to every comment myself. And don't forget, if you have not subscribed, hit the subscribe and then hit the little bell. That way you get alerts when I've put some videos out that are going to help you out, make you a better agent, and hopefully make you more money. Thank you, guys.